Hello, good afternoon, everybody. How you doing? So I know we are doing fine. Okay, today we will be talking with a retired midwife with Anambra State Ministry of Health. Okay, by the person of Mrs. Ezude. Okay, so Ogochukwu. So we'll be talking and arguing on certain things concerning fertility. So she will be giving us her own information, her experiences, and she will answer some questions that has been on my comment section. So now I want her to begin with fibroid and fertility. So she will be telling us what fibroid is all about. She will equally answer some of the questions that has to do with the age range, that have to do with the possible causes of fibroid, and give us the general advice and the remedies to it. Though we have an argument, this argument has to do with the natural ways of treating fibroid, and she will give us her own advice though, and tell us why she is saying and still saying that fibroid has no natural way except removing it surgically. So let's go on with that. Okay, Ms. Ezude, you can continue telling us what fibroid is and tell us what your experiences are in your midwife experiences for 34 years. So please go ahead.
I would say that fibroid is just a tumor found in the myometrium of any woman, inside or outside, non-cancerous tumor found in the myometrium of a woman or inside or outside. That is fibroid.
Okay. All right. Does this fibroid have some age range? Do we have some age range that can actually have fibroid? Does it have any link with ages of a woman?
Yes. Any woman of childbearing age is liable to have fibroid.
Wow.
Then another one is stopping childbearing very early. Those people that married at age of 16, by the age of 30, they are finished bearing a child. They are possible cause of having fibroid on them.
Okay, and what age? Okay, you said childbearing age.
Any woman childbearing age from 25 up can have fibroid.
Okay, with what you say, does it mean that every woman should continue giving birth? Like, since fibroid is fibroid can actually come up if you actually stop giving birth early. Does it mean we should continue giving birth so that we should be able to prevent the growth of fibroid?
If you have a husband, you bear a child. If you don't have, when you have fibroid, you just go and remove it and start bearing your child. It doesn't disturb anybody from.
Okay, can you just give us a little signs for someone to know that she has fibroid?
One, you'll be feeling the fibroid inside you. The abdomen will increase in size. If you lie down flat and palpate your tummy, you can feel it. Then some menstrual cycles, you start when you are having your period. You start pouring profusely.
Okay, so
yes,
bleeding. Okay,
bleeding. Yeah.
Okay. Is there anything someone can actually do to actually stop fibroid challenges?
Yes.
Once
you go to scan and scan confirm that you have fibroid, so before bearing a child, I will advise any person with that to go and remove it, because it may stop you from
conceiving.
Conceiving. Then taking herbs will worsen the situation. So my advice is, once you diagnose that you have fibroid, just go and operate and remove it and have your way right.
Okay, is there possible cause of this fibroid linking to maybe contraceptive? Because people have been asking me, can contraceptive have issues? Can it link to causing fibroid?
Yes,
is there any link to it?
Yes, too much taking of contraceptive in these young girls can lead to fibroid. Even too much alcohol drink or smoking cigarettes and Indian hemps can lead to that.
Okay, what are the medical remedies to fibroid?
The medical remedies for fibroid, any consultant gynecologist will tell you if you have a fibroid, just to go and do myomectomy operation and get it off.
Okay, this removal of fibroid can someone take in immediately the person has this fibroid removal? Once somebody go for the operation and remove it, is there any possible issue, maybe side effect to removing it, maybe delay of pregnancy and the rest of it? Is there any possible link to that?
No, unless if you're up to 45 years of age.
Okay, that
but once you are within 30, 35, if you are good with your God, you just take it immediately and start bearing your child.
Okay, so you're trying to say that because someone is of age, maybe 40, 45, and after the operation, the person also should be needing some supplements to actually fill up the gaps of hormonal imbalance and the rest of it.
Yes.
Okay, but why are you arguing over the issue of the local herb remedies? Why some people are testifying that they've used this herb, and it has cleared them?
It's a typical lies. Since I've been in the system, I saw so many people taking these local herbs. They end up in a very dangerous situation. Coming from myomectomy, you see the fibroid very big, and in fact, most of them even lose their life. And when you meet those patients, they will tell you they've been taking herbs, going to different native doctors. So I discourage that. If you just said you have fibroid, just go straight to a gynecologist who know his work to remove it, and you get well.
Okay, that's the advice you're giving to the young mothers?
Yes, to go to hospital
and remove it. Okay, what about trying? What about trying for those people who actually have the fibroid, but they will keep trying to conceive first during the time of operation and the rest of it? You can actually remove it. So what do you think? What's your take about it?
Come again with your question.
If someone has fibroid and is outside the uterus, so we often give advice that the person can actually go and remove. But what about the people who say that they will keep on trying and trying after several trials and it's not working? What's your advice over their mental health?
No, I will just cancel that person. If it is outside, what of sperm flowing? It may disturb sperm flowing.
Can actually block the tubes and the rest of it.
So once it is there, and luck is different. Okay. It's not what happened to you that will happen to me. Yeah. Some people will have it outside the uterus and they still get pregnant. Some people who have it, they cannot. But immediately they remove it, they get pregnant.
All right, thank you, Mrs. Ezude. Okay, you've heard her, you've heard from someone else, and you see that we've learned a lot today concerning the fibroid aspect of it. Generally, she's saying that local herbs can actually trigger a lot of chemicals into the system and then induce fibroid the more and increase the bleeding that someone is having. And at the same time can actually expose someone to anemic states that can lead to death.
Yes.
All right, so let's take the advice and go for the operation, and then make sure that you're so free and continue to take charge of your health. Remember, she's saying that contraceptives also induces fibroid. So ladies, let's be very careful. All right, the advice she's given is still intact, and we understood today that the childbearing age are the people that are so much exposed to having fibroid. So we are taking this advice, and I believe in the next episode that we'll have a lot to comment, and we'll be thanking her. Thank you for the subscription so far. We'll be waiting for your comments and your questions. Remain blessed from where you're viewing us. Thank you.